AI engine for doctor's perspective. From a doctor's perspective, the bar chart provides valuable insights into the performance of 4 diagnostic tests, test A, B, C, D. Here's how it can be helpful. 1. Identifying the most reliable test. By looking at the heights of the true positives bars, you can see which test consistently identifies the most actual cases of the disease. A taller bar indicates a test with a higher success rate in correctly diagnosing patients who have the condition. Conversely, shorter false positives bars are desirable. These represent cases where the test incorrectly flags a patient as having the disease when they are healthy. A low false positive rate minimizes unnecessary worry and additional testing for patients. 2. Evaluating the ability to rule out disease. Tall true negatives bars indicate a test's effectiveness in correctly identifying patients who are healthy, don't have the disease. This is crucial because a negative test result can provide reassurance and potentially avoid unnecessary treatment. Low false negatives are also important. These represent missed cases where the test incorrectly identifies someone as healthy when they have the disease. A low false negative rate helps ensure timely diagnosis and treatment. 3. Making informed decisions. By comparing the heights of all bars for each test, you can get a holistic view of their performance. A test with a good balance of high true positives/negatives and low false positives/negatives is generally considered more reliable. This information can guide your test selection for specific patients. For example, if a rapid but less accurate test is needed, you might choose one with a high true positive rate even if it has a slightly higher false positive rate. However, for a critical diagnosis, you might prioritize a test with a lower false negative rate even if it takes longer to get results. 4. Identifying tests needing improvement. The chart can reveal areas where a particular test might need improvement. For instance, a test with a high false positive rate might require further research or refinement to reduce misdiagnoses. Similarly, a test with a low true positive rate might suggest the need for a more sensitive test to ensure accurate detection of the disease. Overall, this bar chart is a valuable tool for doctors to visually assess the strengths and weaknesses of diagnostic tests, ultimately aiding in better patient care and informed decision-making. Accuracy in healthcare is a critical concept that refers to the correctness of diagnoses, treatments, and overall patient care. It encompasses various aspects. Diagnostic accuracy, this refers to how well a test or procedure identifies the presence or absence of a disease. It involves measures like sensitivity, the proportion of actual cases correctly identified by the test, low false negatives. Specificity, the proportion of healthy individuals correctly identified as negative, low false positives. Treatment accuracy, this refers to how well a chosen treatment achieves the desired outcome for a patient. It involves measuring factors like effectiveness, the extent to which the treatment improves a patient's condition. Safety, the potential for side effects or complications from the treatment. Procedural accuracy, this refers to the precision and correctness of medical procedures. It involves factors like technical skill, the healthcare provider's expertise in performing the procedure. Minimally invasive techniques, using approaches that minimize risks and patient recovery time. Importance of accuracy in healthcare. Improved patient outcomes, accurate diagnoses and treatments lead to better health results for patients. Reduced costs, avoiding unnecessary tests, procedures, or treatments due to inaccuracy saves healthcare resources. Increased patient trust, patients feel more confident in the healthcare system when they receive accurate diagnoses and care. Challenges to accuracy. Human error, mistakes can occur during diagnosis, treatment, or procedures due to human limitations. Test limitations, no diagnostic test is perfect, and some have inherent limitations in sensitivity or specificity. Incomplete information, lack of complete medical history or complex patient conditions can make accurate diagnosis challenging. Systemic factors, factors like communication gaps, medication errors, or limited access to specialists can affect accuracy. Strategies to improve accuracy. Standardization of practices, implementing evidence-based guidelines and protocols for diagnosis and treatment. Advanced diagnostics, utilizing new technologies and tests to improve diagnostic accuracy. Improved communication, encouraging clear communication between healthcare providers and patients. Patient education, empowering patients to understand their conditions and participate actively in their care. Overall, achieving high accuracy in healthcare is a continuous effort that requires ongoing research, training, and quality improvement initiatives. Thank you.